I'm going to demonstrate provide perineal care for female. First, I'll knock. She says, come in. I'll go in. I'll verbalize washing my hands. I'll introduce myself. Hello, Miss Mary. My name is Ann. I'm your caregiver for today, and I wanted to wash your private area. Is that okay with you? Sure. I'll use the word private area because perineal area is not necessarily a term that everyone is aware of. So next, I will provide privacy. Make sure that my bed is locked, and it is. We'll go and get my equipment. My equipment in this case would be a barrier, a linen protector, and that can be a towel or a blue chuck, 4 washcloths, soap, towel to dry, and a basin. Get water. Don't want the water to be too cold, don't want it to be too hot. We don't want it to exceed 105 temperature Fahrenheit. Bring my water over. Ask my client to check the temperature. In this case, it's a mannequin, so I'll dip her fingers in. Does that feel okay? Yes? Good. Getting ready to provide care, so I'll put on clean gloves. What I need to do is I need to place my clothing, my linen protector underneath of her. So in order to do that, I will have to raise up that side rail over there because I'll have to turn her in that direction. Anytime we ever turn a client in one direction and we're alone, we must raise the side rail so we can turn them towards that way safely. I'll have her put her arm up. Have her cross over her leg and gently help her turn onto her side. Have her roll back. Now at this point, I will only expose, only doing peri-care, her knees to her hips. I like to bend her knees up a little bit just because it helps for cleaning purposes. So we'll take the first washcloth, it's folded in 4 corners. We'll wet that. Don't let it too wet, we don't want to soak the linen. At this point, I'll put a little bit of soap, maybe a quarter size on her. So with this, we're going to use 3 swipes. I'm going to work in a top to bottom downward motion, front to back. Starting at the top here, wiping down with our soapy rag, only coming to the rectum, not washing the rectum. Changing our washcloth, wiping the closest part of her outer labia towards me, down. Don't go to the rectum, just go right above it. I'm on my third corner, and I'm going to clean in the middle. The middle should be cleaned last, swiping downward. This was my soapy rag, and I'm finished with that. So now I'll get my rinse rag. My water's still clean. I haven't gotten any soap in it. Again, we're going to use the washcloth in the four corners the same way. Rinsing, one side coming down, another side closest to me coming down. The third swipe would be into the middle, cleaning downward. Always in that motion. We don't want to bring anything from the rectum into the vagina area. This is my towel. We'll use this the same way, using this side, patting dry, patting dry, patting dry. Now at this point I'm going to have her roll back over again. I kept my side rail up, so I'm going to have her lift up her arm and have her cross over her leg again if she can, and have her roll to her side. Taking my third washcloth, wetting it, keeping it in my four folds, putting some soap on it, getting my soap around. Now we're going to wipe from the rectum all the way up. One side of the cheek, from the rectum, the other buttocks. My third swipe will be directly from the rectum up the middle. So you've seen I've always continued my motion. I started from the top going down and continued the same motion on the back part. That was my soapy rag. This is my rinsing rag. I'm going to continue the same way I did with that. Starting at her rectum, washing this direction, at the rectum, washing this direction, and then my third swipe. Finished with that, taking my towel, a different portion of my towel, blotting dry, and blotting dry. At this point, don't forget to take out your linen protector, always folding away. Having her roll back. Come on back, Miss Mary. Now I need to dispose of my water. Putting that in a commode toilet. Dumping. Rinsing. And drying. And then placing in designated dirty supply area. Disposing of all of my soiled linen. Disposing of my barriers. To the trash. Putting my soap away. At this point I can remove my gloves. I can verbalize washing my hands. And I can go back and finish tending to my resident. Fixing her covers, making sure that she's comfortable. Making sure that her call bell is within reach. If I raised her bed, which I didn't, but if I did, I would then put my bed in the lowest position, and it already is, and the brakes are still on. I would remove privacy, would wash my hands, and I can verbalize that, and skill complete.